ekitiibwa kibe kya patri n'ekya mwana n'ekya mwoyo mutuukirivu.
What hard life this kind of people are having. There are around 500 orphans and around 200 widows, and there are around 80 homes which we have been looking after. As far as our medical clinic project is concerned at the moment, we are trying to reach out to around 500,000 people who need the help, or who need our help, but now we can't afford to do it alone. We started like 5 years ago, just like 2008. We're only two, one nursing assistant, and then me. As we moved on, other people joined us. Like at the beginning, we could only do outpatient. We could not have some other services like laboratory. We could only diagnose patients clinically. It was not laboratory tests, but right now we have services including laboratory services, dental services, maternity services, admission services. We also do outreaches to the community, especially those people who are needy, the widow, the abandoned women. As you see our programs on global giving, women and girls. We need to help these women who are abandoned, these children who are suffering, who do wish to attain some kind of help so that they are also somewhere in this world.
Uganda, there are a lot of women who are faced with problems. There are a number of women who are widows, they have no husbands, their husbands died, some of them are HIV infected, they have so many children to raise, their husbands left them, they have these responsibilities. Some of the husbands are drunkards, they come back in the night, then they start disturbing, beating them around. Domestic violence is very common in Uganda.
If she's here to get something to take to the family, we need to know which kind of family is that. Which kind of family is that? How many people are there? How are they? Because this is an indicator that there is something bad happening at home. Yes. Last time when I was here, the thing was so bad, but at least it's improving. So the mother of this kid is almost abandoned and has some other children. So we do outreaches and we identify such kind of people. This old lady has 15 children, but these children are orphans. Some of them have gone to fetch water. She gets difficult in feeding them. They eat once a day. That's what she can afford to get.
Okay, this is the backbone of our foundation. We aim at improving health, improving our culture, improving social life, improving the holistic life of a human being.
In this project, we are aiming at trying to set up vocational schools whereby we can try to help these young girls and boys find their own jobs, like learning, training them, bricklaying, salons. We train them different career jobs. So that is how we are intending to do.
Some people don't know what's happening behind the main road. So when you move distance from the road, there are people who are suffering. And when you go deep the village, it is worse. When you go to the islands, it is worse. So those are the people we intend to outreach at and get our services.